It starts subtly. Maybe you've been feeling a little more tired lately, or you've noticed some unusual bruises appearing out of nowhere. Perhaps you're blaming the fatigue on age, the bruises on a bump you can't remember, or that persistent infection on a weakened immune system. But what if these small warning signs are your body's way of telling you something far more serious, something that needs attention before it's too late? Leukemia doesn't always announce itself with flashing lights and sirens. In many cases, especially in people over 60, it creeps in silently, hiding behind symptoms we often dismiss as normal aging. But ignoring these signals can cost you precious time and, ultimately, your health. In this article, we're re-diving deep into the 7 early symptoms of leukemia that adults over 60 must not ignore. If caught early, leukemia can often be treated more effectively, but if left unnoticed, it can progress rapidly, sometimes without a second chance. What is leukemia? Exactly. Leukemia is a type of cancer of the blood and bone marrow, the spongy tissue inside your bones where blood cells are produced. In a healthy body, bone marrow produces red cells to carry oxygen, white cells to fight infection, and platelets to stop bleeding. In leukemia, the bone marrow starts producing abnormal white blood cells that don't function properly. These abnormal cells multiply uncontrollably, crowding out the healthy cells and compromising your immune system, oxygen levels, and clotting ability. There are several types of leukemia, some aggressive, some slow-growing, but age is one of the biggest risk factors across the board. More than half of all leukemia cases occur in people over 65, and that number is rising as the population ages. That's why knowing the signs and recognizing them early can quite literally save your life. Why it's so dangerous after 60. The immune system naturally weakens with age, and our ability to regenerate healthy blood cells diminishes. That makes the body more vulnerable to infections, fatigue, and disease. Unfortunately, that also means the early signs of leukemia often mimic what we expect from aging itself: fatigue, bruising, weakness, or mental fog. Because of this overlap, many seniors dismiss these symptoms, or doctors may attribute them to other conditions like anemia, arthritis, or diabetes. That delay in diagnosis can be deadly, especially in fast-moving forms of leukemia, like acute myeloid leukemia, AML. But you don't have to be caught off guard. The sooner you identify the symptoms, the sooner you can take action. Symptom number 1. Persistent fatigue that doesn't improve with rest. We all feel tired from time to time, but fatigue linked to leukemia is different. It's not just being sleepy after a long day, it's a deep, bone-level exhaustion that doesn't go away, even after a full night of sleep or a quiet day at home. Why does this happen? Leukemia crowds out healthy red blood cells, which are responsible for carrying oxygen throughout your body. The result is anemia, which leaves your muscles and brain starved for oxygen. You might feel winded just climbing the stairs, or drained after doing simple tasks like folding laundry. If your energy levels have plummeted and you can't figure out why, don't chalk it up to just getting older. Get it checked. Symptoms number 2. Unusual. Bruising or bleeding. One of the most overlooked signs of leukemia, especially in seniors, is easy bruising or unexplained bleeding. This could look like bruises that appear without a clear cause, frequent nosebleeds, bleeding gums when brushing teeth, small red or purple spots under the skin, called petechiae. This happens because leukemia reduces the number of healthy platelets in your blood. Platelets are responsible for clotting, and without enough of them, even minor injuries can cause significant bleeding. If you're noticing frequent bruises or bleeding that seems off, it's worth asking your doctor for a complete blood count, CBC. It's a simple test that can reveal a lot. Symptom number 3. Recurring infections or slow healing. White blood cells are your body's frontline defense against infection. But in leukemia, the white cells produced are abnormal and ineffective. That means your immune system is essentially on strike, even though your body might be full of white blood cells. As a result, you may notice frequent colds, flu, or sinus infections. skin infections or slow healing wounds, fevers without a clear source, night sweats or chills. In older adults, this weakened immunity can become especially dangerous, leading to complications like pneumonia or sepsis. If you're getting sick more often and taking longer to recover, it's time to ask why. Symptom number 4. Sudden or unexplained weight loss. Losing weight without trying might sound like a dream to some, but in the context of leukemia, it's a red flag. Cancer cells demand a lot of energy, and your body begins to burn through calories, trying to fight off the disease. This isn't a healthy weight loss. It often happens rapidly and is accompanied by loss of appetite, muscle wasting, or nausea. If you've lost more than 5 to 10% of your body weight in a short period, and you're not dieting, see a doctor. Unexplained weight loss is one of the most consistent signs of cancer, including leukemia. Symptom number 5. Bone pain or joint discomfort. Bone and joint pain is common in people over 60 due to arthritis or osteoporosis, but leukemia pain feels different. It's usually a deep, aching pain, not the stiffness of arthritis, that may be centered in the long bones like the legs or arms. This pain comes from the overcrowding of abnormal cells in the bone marrow. Sometimes, leukemia also causes swelling in the lymph nodes or liver, leading to discomfort in the abdomen or lower back. If your bone pain is new, getting worse, or doesn't respond to typical treatments, it's worth ruling out something more serious. Symptoms number 6. Pale skin or shortness of breath. As leukemia reduces your red blood cell count, your body becomes less efficient at delivering oxygen. This causes a pale or sallow complexion and shortness of breath, even during minimal activity. You might notice looking washed out or grayish, getting winded after walking short distances, heart palpitations or dizziness, cold hands and feet. These are signs of severe anemia, which is often the first clue doctors notice when doing blood work. If you've become increasingly pale or breathless without a clear reason, don't ignore it. Symptom number 7. Swollen lymph nodes or a feeling of fullness. Swollen lymph nodes, especially in the neck, armpits, or groin, can be an early sign of leukemia. These glands may feel rubbery, painless, and gradually enlarge over time. Some types of leukemia also cause swelling of the spleen, which can create a feeling of fullness in the left side of the abdomen or make it hard to eat a full meal. These symptoms are often dismissed as digestive issues or tension, but persistent swelling or bloating without clear cause is worth investigating. The simple blood test that could save your life. If you or someone you love is over 60 and experiencing even 1 or 2 of these symptoms, it's important to ask for a complete blood count, CBC. This test checks the levels of red blood cells, white cells, and platelets, often the first indicator that something is wrong. Your doctor may also check for anemia, low platelet count, thrombocytopenia, elevated white cell count, abnormal cells on a blood smear. Early diagnosis of leukemia can lead to less aggressive treatment, better survival rates, and more time to plan and respond. Many forms of leukemia are treatable, especially when caught early. Don't let normal aging hide the truth. Here's the dangerous part. Many of these symptoms, fatigue, bruising, frequent colds, or feeling weak, are things we're told are just part of getting older. But aging doesn't have to mean suffering, and we shouldn't normalize symptoms that are really warning signs. You deserve to feel well, to move with strength, to live with energy, and to understand your body's signals. That starts with awareness. What you can do right now. If you're over 60, consider taking these proactive steps. Pay attention to new symptoms. Keep a journal of how often you feel tired, sick, or in pain. Don't ignore your intuition. If something feels off, it probably is. Request a CBC blood test at your next checkup. It's fast, simple, and informative. Focus on anti-inflammatory nutrition. Reduce sugar, processed foods, and alcohol. Stay active and hydrated. Movement supports circulation and lymphatic function. Prioritize rest and recovery. Chronic stress suppresses immune functions. Talk to your doctor about your risks, especially if you have a family history of blood cancers. Leukemia is a scary word, but fear shouldn't keep you from taking action. The more you know, the more power you have. Catching leukemia early can mean the difference between a quick recovery and a long, difficult journey. Your body speaks to you. Learn its language. Fatigue, bruising, infection. These aren't just inconveniences. They're messages. Listen to them, respect them, act on them. You've made it this far in life because of resilience, wisdom, and strength. Don't let something as serious as leukemia go unnoticed because you assumed you were just getting older.